Hello everyone, I am Michelle Jane Sevilla from Group 20 and today I am going to perform perineal flushing. So perineal flushing is a hygienic care that involves cleaning the perineum or external genitalia. So washing these areas properly is very important to prevent infection, odors, and irritation. So prior to the conduct of the procedure, I have prepared the necessary equipment that I need, which are the kidney basin, bedpan, draw sheet, gloves, pitcher with warm water, pad, alcohol, sterile forceps, 7 dry cotton balls, 7 cotton balls soaked in a cleansing solution. So now, before I begin, I will perform hand hygiene to deter the spread of microorganisms and to avoid cross-contamination. So, good morning, ma'am. I'm Michelle Jane Sevilla, student nurse for today. And how are you? Alright. So, may I see your wristband, please? And please state your name. Okay. So, ma'am, today we will be doing the perineal flushing. So, basically, I'm going to wash your perineal area with warm water and cleansing solution so that you will feel more comfortable and refreshed. Will that be alright? Okay, so ma'am, allow me to close the door for your privacy and so that no one from the outside will be going to disturb you while we're doing the procedure. So now I'll put on my working gloves to reduce the risk of contamination and for infection control. So now position the patient in a dorsal recumbent, and ma'am, can you kindly flex your knees for me? So this is done to provide good visualization of the area to be clean. And also drape the patient, exposing only the area to be used to avoid the patient getting embarrassed and also to provide warmth. Now I am going to place the bedpan underneath your buttocks. So kindly, please lift your buttocks for me, ma'am. And also the draw sheet. This is to avoid the bed from getting soiled. So now I'm going to wash the perineum with warm water. So warm water is used to avoid patients from having chills and also softens or dissolve blood clots. So while doing this, we are also inspecting the area for inflammation, swelling, excessive discharge, and possible presence of odors. So using the pick-up forceps, I'm going to pick up the cotton ball soaked in a cleansing solution. Now I'm going to use my sterile forceps. So take 1 cotton ball to start cleaning the external genitalia. So start from the mons pubis in the midline down to the anus. So never trotting a stroke to avoid contamination, then discard. Now with the second cotton ball, cleanse starting from the mons pubis in figure 7 to the labia majora towards the anus and discard. Do likewise on the opposite side and discard. Now take another cotton ball, start from the mons pubis to the labia minora in figure 7 towards the anus and discard. Do likewise on the opposite side and discard. Now with another cotton ball, clean the groin, starting from the groin, going up to the thigh. Do it in a zigzag manner and discard. So on the other side, and discard. Now flush the perineum thoroughly with sterile warm water. So ma'am, I'm going to flush your perineal area with warm water. So now pick up the dry cotton ball. Now using the dry cotton ball, dry the perineum with the same stroke as what we did earlier. So start from the mons pubis, the midline towards the anus. Discard. From the mons pubis to the labia majora in figure of 7 towards the anus and discard. And do likewise on the opposite side. From mons pubis to the labia minora in figure of 7 towards the anus and discard. Do likewise on the opposite side. Now for the groin area. And then discard and do on the opposite side and discard. Okay ma'am, so now that we are done cleaning your perineum, I'm now going to take the bedpan. So can you lift your buttocks for a second? So now I need you to turn a little to your side so that I can dry up your buttocks area, okay? Now dry the buttocks. Now you can lie back again now. Now spray with antiseptic as needed to promote healing. And after that, I'm going to put the perineal pad with an up-down motion as needed. And now I'm going to drape the patient so that she will feel comfortable. So now ma'am, we are done. How are you feeling? You're all good? Alright. And now I'm going to leave so that you can take a rest. After doing the procedure, perform aftercare of equipment use because a clean environment promotes comfortability. Also, after doing the procedure, perform hand washing and document the procedure. So I did a perineal flushing procedure to my patient at 7 a.m. So there is no redness, skin breakdown, discharge, and no localized areas of tenderness found.